Dr. Michael Ryan with Missouri Vein Care answering a question. Does my teen have a vein condition? And what should I look for? Well, vein conditions can occur pretty much in any decade of life except the first decade of life. So teens can develop a vein condition as well. It tends to become more common the older we get, but certainly teenagers can develop and do develop vein conditions. So the things that we see in teenagers is that their legs are really aching and sore, and you may write that off to growing pains, but the location of the pain is different. It's in the calf muscle. The growing pains tend to be more around the joints, around the especially the knee. And so the other thing is that they have trouble sleeping. They're not sleeping well at night because their legs ache and hurt. Often they don't have a lot of visible veins. They may have some small veins that are visible, and small visible veins in a teenager is not very common, so should raise a red flag that there might be a vein condition. But the vast majority of teenagers do not have a visible vein when they have a vein condition. So it's really going to be their symptoms: aching, poor sleep at night, and they feel tired and run down more so than they should. So I would say for teens, the one thing you want to make sure you're checking on is, are they on their social media all night long or some other kind of problem with sleep. But sleep is probably one of the most common symptoms. Poor sleep, rather, is one of the most common symptoms associated with vein condition. So it's worth checking out. The easiest thing to do is to get an evaluation, which involves an ultrasound to see if the vein circulation is not normal. So this is Dr. Michael Ryan answering the question, what do I look for in my teen to know whether they have a vein circulation problem?